I'm super excited about this. A young, brilliant, talented graduate from our prestigious Ashesi University has come up with an innovative product in health. She calls it a smartwatch, but it does more than smartwatch. It measures things like stress levels, blood oxygen, and you name it. I will not spill all the beans. Join me as I have an interesting discussion with our talented Amanda Enin AJ. Nice meeting you, Amanda.
Nice meeting you too.
Finally, you are here.
Yes.
It's been difficult getting you here. Yeah. You've been busy.
I have.
You have? Yes. Doing a lot of stuff?
Yes.
Like working on your product?
Yes.
Okay, so let's get straight to it. So Ashesi gave you a mention on X, right?
Yes.
How did you feel about it?
So when the post went out, I didn't see it.
Yeah.
I just started getting a lot of messages, and I was like, what's going on? Why is everyone texting me? So I opened my WhatsApp and I noticed there were lots of congratulatory messages, and someone had sent me the post. So I went to check it and I was like, oh, okay.
Yeah. So in the post, they said that what inspired you was your dad's health condition. Yeah, he refused to visit the hospital for a regular checkup. This goes out to all the dads out there. Do your regular checkup. Well, if you don't, Amanda will find a solution for you. But what really inspired you from your dad's condition that led to what we have here today? Okay,
so basically my dad was okay. We thought he wasn't feeling too good, but it was not anything serious. Mm-hmm. So he woke up, went to work, and in the middle of the work day, he started having like heart pains, chest pains, and all of that. But it was bad because most people don't really take things seriously. But for him to decide, let me go to the hospital. So he drove himself to the hospital and they admitted him because it was serious. Mm. Yeah, so basically he had a near heart attack and they said they were surprised he was still alive.
Wow.
So it was a serious thing. So when I heard about it, I was concerned because a lot of people don't go to the hospital. For instance, myself, probably the last time I went to the hospital was when I completed JHS. So people don't take their health that seriously. So I was like, what could I possibly do to prevent something like that? My father was the main aim, but I know that a lot of people have the same
a lot of dads like that out there.
So that's what inspired me. So also I had a fascination with smartwatches for a while. Okay. So it came to my mind that could I do something like that, but then what's also going to be different about mine? Yeah. But that's when I got the inspiration to go ahead and start.
I'm trying to put on a smartwatch for this interview, but I knew you'll come and you'd probably bring me one. So I just had to hold on with that. So your dad's condition led to what we have here, right?
Yeah.
Can I?
Yes.
So this is a smartwatch.
Yeah.
So viewers, this is a smartwatch made in Ghana. This is a prototype, of course. But this is a smartwatch that does many things for people to improve on their health and to take care of their own health. So we can get into it now, right?
Yes.
So what does this smartwatch do?
So it measures heart rate variability, blood oxygen concentration.
It measures heart rate?
Heart rate.
Okay, what else?
Blood oxygen.
Okay.
Accelerometer, which is steps taken.
All right.
And gyroscope, which is relative precision. I am descending a mountain, I'm climbing a mountain. Yes.
Okay.
And then it uses that data to predict stress levels and heart alerts. So there's advanced algorithms for predicting that.
Okay. Can I try it on?
Yes, you
can help me with that.
Sure.
Yeah. Let's see how it feels, huh? So during the interview, we'll see how perhaps it can measure my heart rate.
Yes.
Yes. So currently,
it's the heart rate.
We'll see how it measures my heart rate, and then we'll let you know throughout the interview. All right. And this also goes out to all the people. That's why ExpressMed, we're always championing prevention. Prevention is better than cure. And so that's why we're always dedicating our platforms to promote healthcare. So if you're not subscribed to our Wellness HQ YouTube channel, please do and turn on the notification button so that you always know the next innovative product we have. Okay. All right. So it's connected to the cable so that we can charge it, right? Okay. So currently my blood...
Your heart rate?
My heart rate is currently at 78.
Blood oxygen is 75.
And then my blood oxygen is 95.
It's 95%.
95%. That is good, right?
Yes, that's good.
That's good. So currently it's at 82. So throughout the interview, we'll keep you posted so that you can know how effective and how in real time the smartwatch can measure all these important variables in us. Yes, so take me through the technologies behind. This is a smartwatch, so I assume that it has sensors.
Yes, it does.
And it's able to read the environment. When it's smart, it means that it has the ability or the intelligence to gather information from its environment. In this case, I am the environment. It has connectivity. So there is data that we can capture, and then this data can be fetched and analyzed on a platform. You take us through that, right?
Yes.
And then it also has automation. So it does a lot of the analysis itself.
Yes.
So can you take me through the technology behind Amanda's smartwatch? For now, that's the name, right?
Yes.
Okay.
So basically, it has sensors. It has a heart rate sensor and a blood oxygen concentration sensor. And then it has a sensor that measures both accelerometer and gyroscope data. Those are the main sensors I'm using for now. There's also a real-time clock for telling the time because it's a watch as well, so you need to know like your time and date. Yes. Yeah. So basically, I have a microcontroller. That's where like the heart of the watch is.
Okay.
And the sensor for
is that the light behind it?
No.
Okay.
This is the microcontroller. So with research, I found a microcontroller that has a screen attached to it, so it doesn't make it even bulkier than it is at the moment. So that's the screen, but that is also the microcontroller. The heart rate sensor is beneath the watch because it needs to have contact with your skin. Yes.
Okay.
So that's it.
All right. My SpO2 is currently 99%, and then 87 for the heart rate. Okay. You mentioned that, so the data that we capture here, you fetch it on so is it like what platform do you gather this information?
Okay, so the microprocessor has Bluetooth Low Energy.
Okay.
So with that, I'm able to transfer the data. You're able to transfer instantaneous data, but it can also gather the data throughout the day, and then it's transferred through Bluetooth. So basically, you need to have a device that has Bluetooth, like a mobile phone or a laptop, and then it's wireless, so the cord is just for yes, but it transfers the data gathered to your laptop in a form of a file. You can store it as a file, and then from there, I have a locally hosted website. It's locally hosted for now, but it will be out there very soon. And the file is uploaded onto the website. Then you see the stress levels and the heart rate. So there's algorithms already that I've done on the watch and for the website. So that's what shows you the stress levels and heart rate. Yes.
Talking about stress levels, I think that was one of the main unique features in the app, right? Most of the smartwatches we know measures the steps, your BP, but this one goes further. So what else do we have in the smartwatch?
Okay, so basically most smartwatches measure heart rate, blood pressure, amongst others. But then that's it. Like, so I see my heart rate, I see my blood pressure, but then I don't really know what that does for me. Okay, so maybe my blood pressure is 118/75. What does that mean? But okay, a lot of people might know that the average healthy blood pressure is 120/80 millimeters of mercury. But then, okay, so if it's above that, what does it mean? What should I do? So basically, mine has advanced algorithms for predicting stress levels. So you're able to tell your stress levels at a particular point in time, and it's in a range. So you get a value between 0 and 100 to let you know how stressed out you are. And then the heart alert is 0 or 1. So I used logistic regression for that. So 0 means you are not at risk of a heart condition, so you don't necessarily have to go see your doctor. But 1 means you are at risk of a heart disease or heart-related condition, so you should consider seeing a doctor.
I mean, so a device that can really measure your stress level, that's what we are looking at here. And I know how many Ghanaians or how many people in the world complain about stress due to financial reasons, relationship issues, economic issues. And so people complain. Some people don't even know they are stressed. But with a smartwatch, which we can make it a little cute and smaller on us, it can help you to detect how closer you are to getting stressed and the interventions. Good. So now let's let's move to the part where, so assuming I have the watch and then I'm getting a signal of 1, it means that I'm at risk of being stressed.
Yes, so you should consider seeking professional medical help.
Good. You can contact ExpressMed if you start getting the signals.
Yeah.
But is there a way that the smartwatch can automatically or using APIs connect to other devices or apps, like the ExpressMed app, for instance, or maybe the patient medical provider, so that it's not just the patient who get the alert, maybe the nearest family member or the service provider? Is there that integration?
Yes, the watch can be integrated with apps and websites.
Okay.
But at the moment, I don't have partnerships with any health organization. Very soon, we'll be working together.
Yeah.
So for now, it's connected to the websites that I created.
Okay.
But there's the possibility for it to be connected to other mobile apps or websites so that it could work together with it.
Okay. We're also going to go, you mentioned regression and some algorithms. So we are going to look at how it syncs with AI and machine learning. But before that, I also understand that the smartwatch connects using what we call low Bluetooth energy. Can you take me through that?
Okay, so there's Bluetooth Classic and there's Bluetooth Low Energy. So earlier we used to use more of Bluetooth Classic, but now there's like the introduction of Bluetooth Low Energy. So it depends on the microcontroller that you're using. So for this microcontroller I'm using, it has both Bluetooth Classic and Bluetooth Low Energy. But if you do like a pure chart analysis, you realize that the Bluetooth Low Energy is better. So because of that, I chose to use Bluetooth Low Energy. But they are very similar. So the same way Bluetooth Classic will connect to your phone or laptop, that's the same way Bluetooth Low Energy connects from the microcontroller to the laptop or your mobile device.
Okay, I get it now. So in this case then, of course, like the name sounds, low energy efficiency, that kind of thing. All right. This doesn't have AI or machine learning yet.
Yes.
And it can already do so much.
Yes. So I'm using regression, which you could use. It's also basically for training a model, there are different ways to do it. But now with the introduction of like a lot more advanced things, machine learning is better to go with, and then AI. So I'm working in the background on using machine learning. But for now, with this prototype, it has regression behind it.
Okay. So are we going to have Amanda Smartwatch 2.0 where I have like a voice? You know, now they have like celebrity voice and all that talking to you. So like where Amanda will be telling me that, okay, Patrick, you need to like tone down, or maybe Patrick, you need to move some steps today. You've not done much. Are we going to have that sort of predictive analysis?
So that's like more of AI, but at the moment it still has personalized insights. So for now you're like at rest. So the average healthy heart rate of an adult is between 60 to 100 beats per minute. So for this prototype, at 150 beats per minute, the screen changes from yellow to red, and it says you should consider taking a rest, heart rate too high. But it doesn't have like a voice to say that. The voice things are usually more AI, but while working on it, with time it will get there. So yeah, there might be Mandy Smartwatches 2.0.
Yeah, I like the sound of that. So currently my heart rate is at 74, and then my blood oxygen, yeah, it's at still 95. I'm not doing bad for myself. Yes. Okay, so I talk about how this innovative product empowers users. How does it empower people out there? Like what's in it? What's the value that Ghanaians or the world out there gets when they use a smart product?
Okay, so So it's for preventive health monitoring and empowering people to take control of their health. So with this smartwatch, when you're able to tell your stress levels, heart alerts, you know that I need to see a doctor. It's like having like a mini hospital, mini laboratory on your wrist. So like you know the steps to take, because having a regular smartwatch or just like not having anything at all, it's like you go to the hospital when you think you're sick. And a lot of people actually tend to go when they are in pain. But if you're not in pain, then okay, if I take some medicine, I'll be fine. But then this one lets you know that regardless of the fact that you are feeling pain or no pain, you need to go to the hospital or you're okay. I mean, it's not a professional medical officer, so it recommends to you what you should do to take control of your health. And then as the individual, you should know that, okay, it's about time I go see a doctor. That's what it does.
So take me back a bit. Whilst developing the prototype, did you encounter any challenges?
Yes. So I started this project, and after about a month.
Before that, how long have you been doing this?
I've been doing it for I would say about 4 months.
That's fast.
Yes.
Wow.
We had minimal time to do our project.
Okay.
So it's capstone. Okay. Usually it's a semester, but we're supposed to come up with the ideas the previous semester.
Okay.
But I still wasn't sure what I wanted to do. So when I came up with the idea, I had to go for approval and start working on it.
Yeah, so you were telling me about the challenges.
Yeah, so with challenges, when I started, about a month into the project, I realized I was stuck. Yes, and I didn't know how to go forward. I tried several times. I spent like a week trying to figure out what next to do and all of that, but it wasn't working. So I had to go back to my notes and start the project again. I changed my microcontroller and started the project again, yes. So it was tough, and sourcing of components, some of the components were not in Ghana. I had to ship them. And yes, it also
it's a challenge,
yes. So with all of that, it was hard. And Ashesi provides some components to everyone, but it's like general components. So because of that, not all the components I needed, because it was a project that wasn't exactly part of what they had considered. So most of the things I had to like go out there and find them. So it was a struggle getting some of the components, but yeah. And I'll say like that was like my main challenge. And then financials, because I'm shipping things to Ghana, and then I had to. So this is my PCB design. So I made this. I made the schematic behind this and did the PCB design. But I had to send the design to China.
Do you know PCB design?
Printed circuits board. So this is the printed circuits board. Yes. So I had to send the design to China. For it to be printed and brought back to Ghana like this. And from this, I had to start soldering the components onto the board, and then we came up with this.
I think this is a copy, right?
Yes.
That's another copy. So it means that if you're looking at scaling, we are going to still encounter the challenge of getting the components right here in Ghana. I think this message is for the government, right? That as we are moving into a digitalized era and tech era, there is the need for us to create a tech hub, where we can create and develop some of these components for smart innovations like this here locally in Ghana. Okay, so you were still able to overcome these challenges.
Yeah.
Wow.
I would say my supervisor also did his best.
Yeah.
He was supportive because he helped me get the microcontroller plus the screen. Yes, and it helped. So what we didn't get was a smartwatch battery. So that's why it's part of everything being bulky, because the battery that we got to power it up is quite large. It's larger than this. So if you are attaching it here, everything's bigger. But there are smaller batteries and all of that. So with time we'll be able to get things. But Yeah, I don't know what could be done, but like maybe a company could take it out of the government for like growth of like Ghanaian entrepreneurs, electronics, things like
Talking
that.
about that, how well or how open are you to collaborations, partnership, investment, things like that?
Yeah, I'm definitely I'm definitely very open. So I participated in the presidential pitch, NEIP, and I was given an amount of money to start it up.
So the government is not being bad.
So, the government has been supportive. The president of Ghana was actually at the program, so we were pitching our ideas to him. So yes, that's a start, but there's definitely so much work to be done. Yes, and so definitely partnerships will be very welcome, and it will help all of us, because it's not a project I'm doing for my benefits. I'm doing it for the people of Ghana.
And it's not just for elderly people.
No, so smartwatches, anyone at all can wear it. But maybe the target markets could be people, let's say 40 years and above, but everyone's open to wearing it.
Or people with more sedentary lifestyles. Okay. Exactly. All right. So what's the future outlook? What should we look out for in future concerning the smart product?
Okay, so I'd like to make it smaller, more aesthetic, because I mean, even as a girl, of course, I want something that's nice. And I would be incorporating more sensors. I would like to add blood pressure sensors and some other sensors into it. Yeah, so generally, like, add more information that people really want to see. So when I was starting the project, I did a user survey to ask people what they would like their smartwatch to measure. So some of the things they said is what I did, but there's more that could be added, and I'm still working on machine learning algorithms to make it even better and more accurate. Yes, so there's more to do.
I mean, I'm fascinated by the whole innovation. I do some research, but more paperwork. So I mean, it's interesting to see our young women doing such innovative products, and we are also in the women empowerment era. Is there a message that you have for other women out there, young and old, who are scared of tech and math and engineering?
So I just like everyone, women and girls out there, to take control. Like, it's difficult, it can be challenging if you're in a field where it seems more male dominated, but like, you need to empower yourself. You're in competition with yourself and not other people. So aspire to be the best version of yourself. That's like what I can say, because it might not be easy along the way. You might doubt yourself. I've doubted myself as well along the way, but you are able to do it. Like, if you put your mind to something, you can do it. So just encourage yourself. Look up to people. You can do your research on women that have broken boundaries, have dominated in men's fields, and start being like them. That's what I'd say.
You can do it. I think that's what we're trying to say. In being controlled by yourself, also being controlled by your health. And that's what Express Med is trying to promote. So it's really nice to have this conversation with Amanda. And so stay with us. Subscribe if you haven't, because we'll be bringing you more tech innovations that can help improve our health, your health, I mean. And check out our next post where we review the smartwatch into details. So stay with us and catch you another time.